All right, let's jump right in. With flu season just around the corner, this is your quick and dirty toolkit. We're going to focus on the practical, evidence-based counseling points you'll need every single day to handle patient questions like a pro.
So, here's our game plan. We're hitting 5 key areas. First, figuring out if it's actually the flu, especially with COVID still in the mix. Then we'll tackle the vaccine conversation, nail down who gets treated and when, talk about pregnant patients, and wrap up with managing outbreaks in long-term care. It's basically a roadmap for your busiest shifts.
Okay, section 1. Let's start with what's probably your most common encounter at the counter. That patient who walks in, looks miserable, and asks, "So, what do you think? Is this the flu? Is it COVID? Or just some wicked cold?"
First things first, let's get back to basics with the clinical definition of an influenza-like illness, or ILI. You know the drill, it's that sudden respiratory sickness with both a fever and a cough, plus at least one of those other goodies like a sore throat or just feeling completely wiped out. Now, a really key counseling point here, that fever might not show up much in little kids or in your older patients, so keep that in the back of your mind.
You know, the symptom overlap with COVID is huge, and that's what makes this so tough. But if you're talking to an otherwise healthy adult, there are a couple of big clues for influenza. Number 1 is how fast it hits. It's super abrupt. And number 2 is that high fever, we're talking 38.5 Celsius or more, combined with a dry cough. Those two together, that's a pretty strong sign it's the flu. And you've got to remember, the way the flu presents really changes with age. In kids under 5, you might be hearing about croup or even stomach issues like nausea and vomiting. Then for your older patients, especially in long-term care, don't be surprised if there's no fever at all. Instead, you're listening for a mix of at least 2 symptoms, like a cough, sore throat, or that really deep, debilitating exhaustion.
All right, so we've got a handle on diagnosis. Let's switch gears to prevention. This is where you, as the pharmacist, are really on the front lines. Having that vaccine conversation is just, well, it's absolutely crucial.
Think of this table as your cheat sheet for the season. A few things to really highlight for your patients. For anyone 65 and up, you definitely want to recommend the high-dose vaccine. It gives their immune system that extra kick it needs. For kids, the quadrivalent is the way to go for that broader protection. And hey, don't forget, you've got the nasal spray for anyone who hates needles, and of course, the completely egg-free options for those who ask.
Yes, the question. I guarantee you're going to hear this one every single day during flu season. The fear about egg allergies is still out there, but luckily for us, the official guidance could not be clearer.
So here's the bottom line, straight from NACI. The answer is a resounding yes. They can get the shot. They can get any available flu vaccine, even if they've had a severe egg reaction before. That is a powerful, reassuring fact you can state with total confidence.
Now, let's get ahead of 2 other big questions you'll get. First, oculorespiratory syndrome, ORS, the red eyes, the runny nose. The most important thing to tell patients is that this is not an allergy, and it doesn't mean they can't get the shot next year. Second, Guillain-Barré. You can really put people at ease by giving them some perspective. Their risk of getting GBS from the flu illness is about 17 times higher than from the vaccine. That usually helps.
All right, let's pivot from prevention to treatment. So your patient definitely has symptoms. What's the play? This section is all about making the decision to start an antiviral as simple as possible.
Just think about it in 3 quick steps. Step 1, when did the symptoms start? You know that 48-hour window is where you get the most bang for your buck. Step 2, is this a high-risk patient? So are they over 65? Do they have chronic conditions? Are they pregnant? And that leads to step 3. If the answer is yes, start the antiviral. But remember, if the patient is high risk or really sick, that 48-hour clock doesn't matter as much. You treat them anyway.
So, let's talk practical counseling points. With oseltamivir, the big complaint is nausea and vomiting. Here's your pro tip, especially for parents. You can open up that capsule and mix it with chocolate syrup. It's a game changer. For zanamivir, the main thing to watch for is bronchospasm. That means it is an absolute no-go for anyone with asthma or COPD.
Okay, now, for a group that needs our special attention and care, expectant mothers. They are automatically a high-risk population, and they often come to the pharmacy first for advice.
If you need one single thing to drive home the urgency of flu prevention and treatment in pregnancy, it's this, the 3rd trimester. That's when the risk of serious complications like hospitalization really skyrockets. It's a powerful fact that can really motivate a patient to get vaccinated or to start treatment right away.
So when you're counseling a pregnant patient, here's your cheat sheet. The vaccine, it's safe. It's recommended in any trimester, and Bonus, it protects the baby for months after birth. For symptom relief, acetaminophen is the way to go. Make sure they avoid NSAIDs after 20 weeks. And if they need an antiviral, oseltamivir is the top choice because we have the most safety data on it.
And for our final section, let's tackle a tough scenario that many of you in consultant pharmacy know all too well. A flu outbreak in a long-term care facility. Your expertise here is absolutely pivotal in shutting it down fast.
Before you even think about prescriptions, the first line of defense is just solid infection control. We're talking about the basics, but doing them aggressively, pushing hand washing, making sure PPE is used correctly, isolating residents who are sick, shutting down group activities, and critically making sure any staff who are sick stay home. This is the foundation of outbreak control. And now for the key pharmacy intervention. Once an outbreak is confirmed, the guidance is crystal clear. You start oseltamivir prophylaxis for every single resident who isn't sick yet as soon as possible. And that's regardless of whether they got their flu shot or not. The goal here is to build a chemical firewall and stop that virus in its tracks.
So we'll wrap up with this question to think about. The landscape of respiratory viruses is just getting more and more complicated. As a pharmacist, your role is growing. So the real question is, how can you use new tools like point-of-care testing and build even stronger relationships with local prescribers to get your patients the right diagnosis and the right treatment faster than ever? That's really the challenge and the opportunity for all of us.